Alright, I'm Dr. Ed Cusick. This is what I look like without all my stuff on my face. So thanks again for choosing us to do your toddlers or babies' lip and tongue ties. So we just wanted to go over what's in the bag with you, because sometimes everything is really hectic and chaotic and your baby's crying and you may have traveled a long ways too. So we just wanted to have something that you could look back and see what is all this stuff there. So the one thing that I did show you is the home groove director, and everybody should have one of these. And again, this is, instead of using your fingers, the little groove part is where you're going to put it on the base where we did the revision at. And again, remember, and there's a video that we showed about this, but you're just kind of elevating it up for the upper lip. Do that 3 times, and then the tongue one, you're putting it down to the base, pushing down to the floor of the mouth and back towards the throat, and you only need to do 1 of those. So this can be reused numerous times for you. Gauze. So in case there is a little bit of bleeding in there, there's a 4x4 gauze. Numerous gauze packets in there for you. Just moisten it a little bit. Kind of roll it in a cigar shape like this, and then you can put pressure on it. But we would like to have you use large ones, so accidentally the baby doesn't maybe swallow something. So the gauze is in there in case you might need it. Also in there is a tea bag, and no, your child isn't going to be drinking tea, but tea has tannic acid in there, so if there's some bleeding, you can just take the tea bag out, moisten it, and keep some finger pressure right in the spot where it's bleeding at, as at least probably about 5 minutes if you could do that, and that'll stop the bleeding. So just a normal tea bag. Another thing that's in there is Sweetums. So this is a little material that if your child or baby is not nursing, you could either put it just unscrews off like this, and you could either put a little drop on your nipple, or if you're bottle feeding on the nipple itself, and then the baby will be more attracted to it. It's just fructose basically. So and then also post-operatively, it just helps a little bit with the discomfort for the child, but mostly just used to make sure that they attach to your breasts correctly. And then the final thing is a post-operative packet here. It talks about everything we've basically gone over. The only thing that's a little bit different is that it shows using finger pressure, but we actually now have given you the groove director, so everything that was with fingers is basically with the groove director, and it talks about how things heal. So if you see a white patchy area, that's good, it's not infection. And the white patch area is just like a scab, and that will come off in about a week or 2. And then, you know, the stretches are extremely, extremely important. Again, if you don't do the stretches, things will reattach, and then all the symptoms will come right back. Sometimes you're recommended to see maybe a lactation specialist, IBCLC, or even a chiropractor that does craniosacral therapy. So I normally tell patients or the parents that 50% of the time everything's great right after the revision, and the other 50% is kind of a gradual process. So we really don't know where your child is going to fall into until after the procedure. So that kind of talks a little bit about other people that we utilize for it. So there's all this, and then our staff should be giving you a call usually a day after the procedure, so if you have any questions, they can answer those for you, or if you'd just like to call us, if you have questions, we could try to answer those, but sometimes we're really busy, so we could try to call you back, but the staff should be calling you in a day afterwards. So that's all that's in your bag. So now you know what all these little pieces are for, and hopefully everything is have great success. And thank you again for allowing us to be able to do this treatment on your child.